Hello everyone, and welcome to the OR. Our patient today suffered a very tragic fall, very severe fall, and as you can see, he has quite a bit of bruising, some lacerations here. So we're going to perform surgery today to see if we can see inside, if he has any internal bleeding or internal organ damage. The patient has already been given a general anesthetic and already has been informed of how drastic of a surgery this is going to be. So we're going to get started and see what we can do for him. He has a lot of pain and he's had a lot of bleeding and general lethargy. So we're going to see what we can find and what we can do for him. I'm going to start right here at these main lacerations here and just start by taking just a little bit of the top layer of skin. Just barely gonna take just a little here. Just kind of peel a little of the skin back. Kind of see how deep this bruising goes. I'm gonna make a cross cut here and here. And then we're going to see if we can open this part up and see what's going on here. Yeah, it seems like that is just mainly superficial. There is a little bruising in the tissue under the skin, but mostly looks superficial. Okay. Now the other part here looks a little more disturbing to me. We've got a big bruise right through here. So let's just take a little bit here and see what we can see here. Okay. Yes. So as I suspected, this bruising here is a lot deeper. So we're going to have to get into the tissue a little bit more here. Okay. So I'm going to try to make an undercut on the tissue very carefully, just to make sure we don't have any organ damage under here. Okay, let's see here. Okay. Again, it looks like he got lucky here. This is mostly superficial. I don't see any really big problems here, so all we'll have to do is have this sutured back, suture this back up, and he'll be just fine. But the big concern that I have is we're going to have to get deeper into the tissue, right through the middle, to make sure there's no internal bleeding. Now, I've explained to the patient that this is going to be a very, very drastic recovery process because we're having to cut so much tissue. But if we don't, there's a possibility that the patient could actually suffer much more damage due to internal bleeding, possibly even leading to death. So we don't want to let that happen. So I think it's important that we go all the way down to the main organs, just to make sure that everything's okay. Skin and tissue will heal, however, internal bleeding won't. So I'm going to very carefully try to separate the upper and lower half of the patient. Sometimes it can be just a little tricky. There we go. Okay. Okay. There we go. Oh goodness. Okay, if you can see that there. Okay, these should not be here. You can see those should not be there. Those are blood clots from internal bleeding. And it was exactly what I was afraid of. Let's see if we can get those removed. Now the good thing is it does look like the bleeding has stopped here, but we need to get those clots out. To make sure they don't cause any problems with the internal organs. Okay, let's see here. Okay, that looks good. Okay. Yeah, okay, we've got it all out. There's a little bit of blood there, but we're going to leave that there because I think that's possibly a small clot that's actually stopping the bleeding there. So we're going to leave that. There's another clot there. I don't see anything there, so that looks good. Okay. Well, it looks like we did find some internal bleeding in the patient, and we got it fixed. We got it repaired and resolved. So I'm going to leave the patient just like this. Let's get that out of there. Okay. And the superficial skin and bruising and lacerations will all heal. So I'm going to get my nurse to suture this patient up, and hopefully they will make a full recovery. Recovery time probably around 6 weeks, maybe up to 8 to 10 weeks. But like I said, this patient should make a full recovery. So I'll get my nurse to suture this patient up. And we'll get these here. Go ahead and throw those in the trash. Set him here. We'll take our tools and have those cleaned and autoclaved. And thank you guys for joining me in the OR. I'm glad to say that we have another successful surgery on our patient, and I hope you'll come back soon when we perform our next surgery. If you would like to follow me as I perform these miracles on these patients, please subscribe to the channel and hit that notification bell so you'll know every time a new surgery is about to take place. Thanks again, and have a great, healthy day. Goodbye.